My name is Tianyun. Today we are going to talk about psychology disorder, post-traumatic stress disorder, and Munchausen syndrome and Munchausen syndrome by proxy.
Yeah, just as Kenny said that today we will talk about two mental diseases. First, we will talk about post-traumatic stress disorder. Post just means after. Traumatic means hurt, just something you suffer on war or lost your family. So next we will talk about Munchausen syndrome by proxy. Munchausen is a person in the Asian, and he's first the guy that have this disease.
Okay, what is Munchausen syndrome? Munchausen syndrome is a group of mental illness called affective disorders, in which a person exaggerate or make up an illness or injury. And Munchausen syndrome and Munchausen syndrome by proxy are different. Munchausen syndrome is patients hurt themselves. They want other people to take care of them. And Munchausen syndrome by proxy is the patients hurt other people and they want to take care of other people. But this picture is talk about what is the Munchausen syndrome.
Yeah, next I will talk about the prevalence of Munchausen syndrome. Now we don't have reliable statistics, we don't have reliable data to prove the prevalence of this disease. But I think the reason we don't have disease was because obtaining a cure or treatment is difficult because some patients will pretend that they didn't have this disease, and they will try to go to different doctors to help them. So it is hard for us to get data from this disease.
Symptoms, the Munchausen syndrome, they usually are healthy, but they won't be illness. They want other people to take care of them. So they sometimes to tell lies and hurt themselves to get ill. And the Munchausen syndrome by proxy, the patients, they usually hurt other people and they want to be the doctor to take care of other people. This is the difference between the Munchausen syndrome and the Munchausen syndrome by proxy.
Yeah, next I will talk about what causes Munchausen syndrome. Now, just as other mental illness, we don't have cause unknown. The cause is unknown for this disease, but the researchers have done many experiments to investigate the factors that affect this disease. They call that some people who have a history of sex, physical or emotional abuse, and serious illness during childhood, a relative who are seriously ill or dead, just like you lose your family member, something like this, will hurt you inside, so you will get this disease after they die. And a career in the health industry or desire to work as a health professional. And we have to mention that some patients have good medicine knowledge, and they are good at to take care of others, and they are good at to be a doctor, something like this.
Munchausen syndrome is a psychology illness, so we don't have the advantage treatment for this illness. And here are some ways we usually use to protect this treatment. We modify the person's behavior and reduce their misuse or overuse of medical resources. And treatment aims to work out any underlying person psychology issues and to help patients avoid dangerous and illness medical diagnostic.
So next we will move on to another disease. We call it post-traumatic stress disorder. This is more common than the Munchausen syndrome. Post-traumatic stress disorder is a mental health condition that's triggered by a terrorist event, either experiments or witness it. Witness means just watch it and you experiment it. So this is from the Mayo Clinic website.
Currently, PTSD, every age people, including children, can get the PTSD. And PTSD may run in the family. If your parents or grandparents get PTSD, you may easily to relate PTSD than other people's. And for gender, women are more likely to develop the PTSD than men.
Yeah, actually we'll talk about some symptoms. First is we'll do some instruct memories. Instruct mean in what? Just like when you work your assignment or just work something, and you may be some memory will come into mind occur immediately, some bad memory, so you will disorder and you will get stress. Another will be the avoidance and negative changes in thinking and mood, and changes in emotion recurs. You may avoid to communicate with others and avoid doing things with your friends.
We don't know the should cause the PTSD. The PTSD possibly caused by difficult mixed, but for people who get very bad memories in their life experience, and they don't find any way to relate it, they may get the PTSD. And here are some case to lead the PTSD.
So how to change PTSD? We have two, just as other mental illness, we have two ways to change this illness. First is psychotherapy, just to communicate with others, and the doctor will tell you that something can help you to relieve your stress and help you to just to get relief from your memory. Another one is medication. It's antidepressants and anti-anxiety medications. This is very common. We can buy from the CVS, something like this. But this don't have much effect than the psychotherapy.
Those diseases, we don't have the good way to prevent it. But for this disease, it's necessary for us to find it as early as possible. And for the PTS patient, the good way for them to recover is go outside, find the psychologist to get some help and talk with friends to make them relax and make them comfortable. It's good for them.
Thank you for listening. And this is our reference to travel from these two websites. Thank you very much.